Hi everyone, I'm Dr. Powers here at the Ward Institute, and we're talking today about hair transplant. So I wanted to discuss first off, who needs a hair transplant? And the answer really is anybody that's bothered by their hairline, or maybe they've also had thinning of their eyebrows. We do that here too. So a hair transplant typically is taken from the back portion of the head. And if you think about it, somebody that's had advanced pattern baldness always maintains that horseshoe aspect of the back of their head. And that's because the hairs that are in the back of the head are not subjected to testosterone and they don't recede with time. There are two ways to accomplish a hair transplant. One way is called the FUE, or the follicular unit extraction. And what that is when we go in and individually harvest an individual hair follicle and take that follicle from the back of the head and transplant it to the recipient site. What's interesting about that is that the hair always maintains its memory of where it came from rather than the memory of where it's going to. So it will continue to grow as if we took it from that area, and it'll continue to grow as if it came from that area still. The other way of accomplishing a hair transplant is something called an FUT. And an FUT is when we take a strip from the back of the head, so an entire strip including skin is removed along with the hair follicles. And then the hair follicles are harvested from that strip. That typically will leave a big scar on the back of the head, and that can be appropriate for somebody that wears their hair longer, but it may not be appropriate for somebody that has a shorter hairline. So what to expect from a hair transplant? You come in and you go home the same day. So it's an outpatient procedure. We typically give you a light sedative that you take by mouth, but you're able to talk with us and you're breathing on your own. So it's not done under a general anesthetic. We accomplish this with our hair team. Our hair team is composed of an entirety of hair transplant techs as well as us, the surgeon. And we go ahead and design your hairline and are able to make a very unique and customized plan for you. Patients oftentimes ask me, what's the appropriate time to go through a hair transplant? And typically what I like to tell them is, if your hairline has been bothering you and it's been stable, meaning that you've had some hair loss but it's settled out and you're not having a rapid amount of hair loss at that time. So typically for patients that can be anywhere between their 30s up until age 50. Patients that are not as ideal for a hair transplant are somebody that's younger. So somebody that's 18 to 25, it might be seeing some rapid hair loss, but they may not be settled out at that time. One of the most common questions that I get is a hair transplant permanent? And the answer is yes. So a hair transplant, when we take the hair from the back portion of the head and transplant it to the recipient site, oftentimes which is the temples, that hair will continue to grow as if it came from the back of the head. However, what it doesn't do is it doesn't stop the hair growth that you may already have, that may already take place naturally down the line. So you can undergo multiple hair transplants if needed, but typically most patients are going through one hair transplant. The entirety of the hair transplant lasts anywhere between 6 to 8 hours, just depending on how many grafts need to be harvested. When we talk about how many grafts patients typically need, if you think about the size of a CD-ROM, that can typically hold about 2,500 hair grafts. And so if you think about how much volume loss you've had in your hairline or on your crown, that's really a good estimate in order to know how many hair grafts you might need. A lot of our questions afterward tend to be, how much pain am I going to have? And what is my recovery going to look like? So when we take the hair from the back of the head and transplant it to the front, you're going to have a mild headache for about 10 days afterward. You may also have some swelling and some bruising. And sometimes that swelling and bruising can migrate from the forehead and kind of pool around the eyes. So you might even have some black eyes around that area for about 10 days. So the normal post-operative course with hair transplant is that the hair follicle is taken from one area, the donor site, and transplanted to the recipient site. Those hairs that then are in that area, they actually go through a shedding phase. So all patients will lose those hairs out of the follicle in about 3 months. A lot of patients are worried by this because they think, did my hair transplant work? And the answer is yes, your hair transplant worked, but the hair itself went into a shock phase and is now shedding. Most patients are starting to see new hair growth by about 6 months post-procedure and up to about 9 months post-procedure. But your final results after a hair transplant are not going to be apparent until 1 year to 1.5 years out. Patients that are on any of the other topical medications or oral medications to help promote hair growth can restart those after the hair follicle has matured. And that typically is going to be after we've met at that 6-week mark and make sure that everything looks like it's in place, and then we give you the go-ahead to restart those medications. Something that's unique to the Ward Institute hair transplant is that included with your service is already a shampoo, conditioner, as well as a hair growth serum. So we take care of everything that you need afterward in order to promote the hair growth.